Yeah, we are live.
We are live?
Yeah.
Okay. We'll start then.
Yeah.
Is the audio fine, Priyanshu?
Yeah, it's fine. You can go. Yeah.
We'll start.
Okay.
We're good to go. Hello, everyone. Good evening. I'm your host for today's session. This is Meenakshi here at this end. And I, on behalf of the Energery team, would like to welcome all of you for today's session on health. And I can see a lot of new faces, new names in our participant list. Of course, some of you are a regular on our page and you have been actively participating and joining us for most of these sessions that we've been having. But since we also have a lot of new participants for the session, I would like to briefly take you through what this whole initiative has been all about. So, Energery is basically a not-for-profit trust. And once, the lockdown started and during this pandemic, we have been conducting a series of webinars. We've been discussing a range of issues. Every day, particularly, we discuss, we invite speakers who are working on a diverse range of subjects, from health to education to entrepreneurship, and we've been having a lot of engaging and enriching sessions so far. So this has been running for more than 2 to 3 months now. And so every Monday we host a session on health. And the basic idea here has been to, develop some kind of a platform or a network through which we get to know about the kind of work that is happening in Northeast India, and also about, issues that need to be talked about, issues that need to be really discussed and deliberated upon. So the session on health has been really important in that sense, particularly at a time like this, when, there has been a lot of talk on health as a sector. So this has been the primary idea of, organizing webinars on behalf of Energery. And so that's the background of what we have been trying to do through these webinar series. So in the midst of all this, we have realized that, health has grabbed a lot of attention. Health as a sector has grabbed a lot of attention from all quarters. And very importantly, governments all across the world have realized that it's really important to invest in health. Looking at the current scenario that we are grappling with, it's really important to invest in health as a sector. It has also made institutions realize that, research and development needs to be an important component. And also there have been a lot of talk and deliberation at the basic household level. So every random person we meet would be, at a time like this, would have something to say, something or the other to say on something related to health. So this has definitely generated a lot of discussion and conversation around health, something perhaps which has never happened before. And it has also, started the conversation around hygiene and sanitation, particularly when we talk of the COVID-19 pandemic. So while all of this awareness building, while all of this talk is definitely good, it's happening, it needs to have happened perhaps long before, but at the same time, the current situation has also flagged off and raised a lot of concerns. I think particularly at an individual level, I would say that it has also raised a lot of immediate concerns for us as individuals, like this whole thing about safety. Like, is it really safe? While there is this importance and the awareness that is being built as far as COVID-19 is concerned, as far as how to wash your hand, all of that is happening. It has also raised concerns as far how easy or difficult it is right now to access all other forms of healthcare services. If I am currently suffering a certain kind of an ailment, would I really seek some kind of a healthcare service at the hospital? So all of these have really, at some level been also very unsettling for us. It has left us with a lot of questions. And one such field is the field of, physiotherapy, which often is not, most of the time is not really talked about. This also needs to be relooked at, that in terms of what could be the possible role of physiotherapy in a situation like the COVID pandemic, in in a pandemic situation, or if I can say a post-pandemic situation. So since our mobility, our movement has been restrained to a great extent, it has also become really difficult to really go out, move out, and access a certain kind of service. Whether we should be calling somebody at home and seeking a certain service, it has raised questions for the elderly. It has raised questions for pregnant women or lactating mothers. So I think this remains a very important domain under medical sciences that needs to be discussed. And we have with us, we are very fortunate to be having amongst us today our speaker for this evening, Dr. Pallabi Goswami. So I'll just quickly take a minute to introduce our guest. So Dr. Pallabi Goswami is a practicing physiotherapist, and she is currently working as the principal in the College of Physiotherapy and Medical Sciences under Pew's Group of Institutions in Guwahati. She is also a member at the Indian Association of Physiotherapy, as well as recognized as a state coordinator of Assam IAP Women's Health. And Dr. Goswami has also been practicing. She has been continuing her practice at Digonta's Rehabilitation Center in Guwahati. So we are here to be discussing particularly the role of physiotherapy as a field during the pandemic, and what could be the important or the critical areas that need to be looked at as far as digital health, which is perhaps a new domain. Even for me, I'm very new to this whole domain. So I hope this session will be really enriching for us. So I really look forward to having a fruitful discussion. So over to you, Dr. Goswami.
Yes, thank you so much, Meenakshi. And thank you to the team of Anajori to give me this platform today. So, first of all, as she has already introduced me, so now I would like to talk a little bit about the pandemic which is going on, and as well, like, what is the role of physiotherapy in this pandemic? I'm pretty sure that most of the people, they are not having much of the idea of this role of physiotherapy in COVID-19. So today, I would like to give a insight to this field. What is the role of physiotherapy in this COVID-19 patient, in severe, moderate, and mild cases? Then overall for the rehabilitation of the general population. And also, I would like to give an overview on the digital health, which is a very new sector, and especially from the land of Assam. So, so I would like to start with my presentation now. So I hope you all will have a take-home message from this presentation today. Yes, Meenakshi, can I have the presentation, the PPT? Yes. I would like to have a complete question session from all the participants here, so that I can answer your things, so that you all have a clear query from my presentation. So today my topic of presentation is, what is the role of physiotherapy during the pandemic of COVID-19, and overview on digital health. Can I go to the next slide? Yes. So I think all of you have the idea, but still I would like to tell something about physiotherapy. So physiotherapy, it is a part of the health profession which deals with the physical issues of the patient with the help of exercise prescription, electrical and physical agents, mobilization, health education, and evidence-based treatment. At present, at this point of time, at this point of not only for COVID-19 or the present scenario, physiotherapy is giving its 100% to the society, where we are you can say we have taken a vow to make the society pain-free, or you can say to mobilize the society, to move the society, or to move each individual out of their illness or out of their boundaries. So physiotherapy is doing its wonderful work, and there are lakhs of physiotherapists working around the nation, around the globe. So I would like to give a view on this field in today's pandemic. Next slide, please. So physiotherapy treats acute and chronic conditions, neurological conditions, musculoskeletal conditions, pediatric, different kind of pediatric conditions. We have a great role in this. Then geriatric, in the old age, we are having a role, how to make the patient or how to make a person mobile, how to make a person's joint muscle mobile. There is a great role of physiotherapy in geriatrics. Then cardiovascular and respiratory conditions, and sports injuries, obesity management, and also in women's health. Women's health, I want to mean about the gynecological women's health along with the other women related issues, which is somewhat neglected in today's date. So physiotherapy is doing work in all these different sectors. I hope I'll be more clear to you all in the coming slides. Yes, next. It is just a picture like how we are working. Yes, fine, next. Yes, so now I would like to tell something.
Can you hear us?
Did the video just pause?
Can you hear us? Yeah, it's paused. Can you hear us?
Every day. Yes, yes.
Okay.
Yes.
You will have to just
Yes,
repeat the last two sentences you said because your video just.
Okay, okay. Yes. Actually, some technical error, I guess. Okay. So I would like to say something about my experience in this field of physiotherapy. Like till now I'm working since 15 years in this field, and I have seen numerous cases in different sectors. So more commonly, we are seeing more of the lifestyle diseases every day. Lifestyle diseases means when we are doing our day-to-day life activities, how our body, because see, our body has a limit. When we exceed that limit, our joints, our muscles, it starts occurring in a different way, and that causes certain lifestyle diseases, which is very common. Neck pain, back pain, these all are something related to the lifestyle diseases. Then treating conditions related to obesity more often. Nowadays, obesity is seen more and more in the society. And this obesity is causing more of the other conditions like high blood pressure, like diabetes, and some other conditions will be going to relate it to, is going to be related with this obesity. For example, high blood pressure can cause a stroke in the long run.
There is the audio.
You can say diabetes can cause certain imbalance. So these.
Ma'am, you are on. Yeah.
Sorry. Yeah, can you hear me?
Yes, ma'am. I can hear you. You're audible. Hello.
Yes. I'm so sorry. Bits are coming in between. So, yeah, I'll continue with this. Seeing most of osteoarthritis, most of, you can say, low back pain, all these things are related to the old age also. And other conditions in the field of neurology, because my specialization is mainly in neurology. So orthopedic, pediatric, cardiorespiratory, all these conditions. Yes. Yes.
Ma'am, can you hear us?
Yes, I will definitely come to the question because I know there will be so many questions which I have given here. We are treating, okay, stroke cases, Parkinson's.
And there is some issue with your audio.
Yes.
Yes, ma'am.
Yeah, am I audible? Yes.
Yes,
Can I go to the next slide? Next slide, please.
Ma'am, I think you need to repeat the last two lines because we couldn't hear them.
Okay, yeah. No, I'm seeing last para of this about the different conditions in neurology, orthopedic, pediatric, yeah. All these conditions we are treating daily, and spine rehab. I have given a word, spine rehab, where we are seeing mostly the neck pain, the upper back pain, the low back pain, all these conditions which has so many other treatment procedures also. And the stroke and the Parkinson are like a field or the mostly affected field in today's date. So these are the conditions which are very commonly coming to us, and we are treating this kind of things. So yeah, next slide, please. Now I'll be coming to COVID-19. So what is COVID-19 and what is the impact of COVID-19 on our health? So here I would like to raise a question like, is it okay if I'm talking only in English, or anyone wants me to talk in Assamese or Hindi, English, anything?
You can blend in both. You can blend in both
Yes.
Assamese and English. Yes.
Yes.
May I request you slightly go a little slow because some of these things are very new to us. Yeah.
Yes, sure. Yeah. So I will be going now to the impact of COVID-19. So what is COVID-19? All of you have an idea, right? What is COVID-19? It is a coronavirus. So it is an infectious disease caused by severe acute respiratory syndrome, which is also called as SARS. And it is the name of this coronavirus, it is SARS-CoV-2. So it is the severe acute respiratory syndrome coronavirus 2, which is now causing, you can say it's heavily infecting almost all the nations throughout the globe. So coronavirus, a virus to when it affects our body, what are the, how it affects and what are the changes that occurs in our body. So all of you have the idea now that coronavirus, it usually affects the body from the droplets from an infected person. Okay, when a person coughs, when a person sneezes, or you are in a compact space, coronavirus patient or logot thaku, then also we have the chances of getting the disease. It can be also transmitted through any surfaces touched by the patient. So wherever the patient is touching, if you are touching, and that hand, if you are putting in our nose, mouth, or eyes, these three are usually the entry point for the coronavirus to our body. So I have put this point here. It enters through eyes, nose, and mouth, and then to the mucous membrane of the throat. Okay, from eyes, mainly through the nose and mouth, it is entering to the throat. There is a mucous membrane where it is going and resting for some time. Then the virus is getting inside the lung. So prathomate a virus to amar naak, mukh আর চক্ষু এই তিনটা entry point এর ভিতর ঘুমায়। Then it goes and it
Ma'am, there is a, I think the issue again.
yeah, can you go to the next slide? Yes. Yeah. Yes. Now, once the patient get the infection, so আজি যদি মোৰ infection হৈছে, then from 2 দিনৰ পৰা 14 দিনৰ ভিতৰত 2 to 14 days, the patient will show the symptoms of fever, জ্বৰ, cough, কাহ উঠিব, shortness of breath, that is উশাহ লোৱাত আমি কষ্ট পাওঁ, then fatigue. Fatigue is যিটো আমাৰ ভাগৰ লাগাটো, that is okay, I got a message that please continue in English. Okay, then I'll continue in English only. So within 2 to 14 days, the patient will show the symptoms of fever, cough, shortness of breath. Fatigue is something what we feel as tiredness. Body ache. Body ache is the body pain. Sore throat, what we have in our throat, that's kind of uneasiness, or it is called a sore throat. I think all of you have the idea. Runny nose, that is the runny nose, like cold and cough, cold and flu kind of a symptom, and loss of taste and loss of smell. This is also one of the symptoms that we get. Then diarrhea and vomiting. So these are the symptoms mostly seen in the COVID-19 cases within 2 to 14 days of infection. Now, symptoms of COVID-19 is somewhat similar to cold and flu. Okay, so cold and flu, as like we have a runny nose, as like we have a mild fever, that kind of symptom we get in COVID-19 also. So what happens to our lungs? So this virus, it enters the nose, then it goes to the mucous membrane of your throat, then it enters the lung, and it causes the lung to get inflamed. Inflammation is a word which is somewhat similar to like it's an infection. Okay, it's very common term. It is infection. So it gets inflamed and making it tough to breathe. So I'm putting it very simple that after inflammation, we are getting a breathing difficulty, and actually there are so many other stages that occurs. So this breathing difficulty is leading us to a pneumonia like a symptom. So there is a shortness of breath usually develops. This specifically, this shortness of breath, it usually occurs within 5 to 8 days after the infection. So these are the common symptoms what we get in the COVID-19 patient. Okay. If I'm clear, then can I go to the next slide, please? So this is, I have put just a picture where the COVID-19, how it enters, how it goes to the lung, and this red part in the bluish picture, in the X-ray, there is this red part is showing the pneumonia kind of a infection in that area, and specifically that area of the lobe will get less of the air, and that will cause the breathlessness. Okay, yeah, next slide. Is it okay, Meenakshi? My pace now, is it fine?
Yes, perfect, yeah.
Okay, yeah. Thank you so much. Now the problems. What problems? Yes. No, the next slide. Next slide. Yes. The problems observed in the COVID-19 patients, especially in the ICU hospital stay, then that is a severe case. Then we are going to the moderate and the mild. So see, physiotherapy, when we are treating a case, we are not having much of a, you can say, role in the very mild cases. Like if I'm getting an infection, if I'm not having any other issues with breathlessness, or if I'm not having any severity that I need to go to ICU, then it is fine. As such, in the you can say breathing part, I'm not having much of the work now. But once the patient enters the ICU, ICU is the intensive care unit where the patient will be in a critical condition. So I'm starting from that part. Okay. So in the phase 1, that is the critical condition, breathlessness is noted, which needs urgent ventilatory support. Okay. If it is a severe breathlessness, then we have to go for ventilatory support. Prolonged lying in the bed. If the patient is lying in bed, because the patient may lie in the bed for 2 months, 3 months, or more than that. So that lying in the bed can cause a back pain. Prolonged immobilization. Immobilization means when I'm not moving, I'm on the bed, I'm not moving at all. That can cause a muscle atrophy and weakness. We also observe breathing muscle weakness in these patients as they are having difficulty in breathing. So one more point I'm adding here is the bed sore. Bed sore is something when I'm on the bed, suppose for 2 months or 1 month or 1.5 months. What happens if I'm continuously in one position? My skin starts soring. Soring means it gives a small kind of infections, and that causes the skin to sore and the skin to have a bed sore, which is very difficult to treat. Okay. These are the problems we mainly see in the critically ill patients of COVID-19. Yeah, next slide, please. In improved cases, now the patient is getting all the treatments, all the medications, all the oxygen therapy, everything. Then in the improved cases, what are the problems we get there? Training needed for early mobilization from bed in and around. Early mobilization is, it is good like as soon as possible if we can make the patient out of the bed, and if you can make him walk or move, that is called early mobilization. We are mobilizing the patient from the bed and around. So that is needed in moderate phase once the other critical symptoms are over. Okay. Then treatment needed for respiratory improvement and need to improve the muscle power. Muscle power is something which occurs due to deconditioning. There is a word called deconditioning, means the patient is in the bed for a long time. There is no movement. There is no muscle power, muscle working. So ultimately what happens, our muscles, it goes for atrophy or decreasing in the muscle power. So that thing has to be tackled. Now rehabilitation phase. Last one is the rehabilitation phase that we have to, that I'll continue in the later slides. Now here, what is the role of physiotherapy? What are the techniques we use? Just an overview I want to give you. In the hospital stay or home stay, some of the patient, they may be in the hospital stay, or some cases they may be in the home stay. In foreign countries, even the physios are going to home in cases of home stay cases where we are giving the treatment. But now here in the hospital stay, what are the things we are going to give? So techniques, what are the techniques? So first technique what I have given here is airway clearance technique for ventilated patient who shows the sign of inadequate clearance. Means your airways, the air sacs inside the lung, which are getting fluid or which are getting occupied by the secretions, that needs to be cleared, because our lung is not for fluid. Our lung is for the air. So until and unless we clear the secretions, air cannot go inside and it cannot give us a proper breathing phase. So that is why this airway clearance technique is very important. Next is the positioning. Positionings for decreasing the breathlessness. That is important to decrease the breathlessness. Number 3 is active cycle of breathing techniques. This is another technique what we can give to the patient. Then percussions and vibrations. So these are certain techniques which we give to loosen the secretions of the lung. Lung, which is getting all the secretions, all the mucus plugs, we need to loosen, then we need to take it out. So how we will take it out? We have certain techniques of coughing and huffing. So certain coughing techniques we give to take out the secretions from the lung. Then we have a Pep device. I have given a picture of Pep device. So Pep device or positive expiratory pressure therapy, which is a technique which helps the lung not to collapse. Okay, because if we have a secretion for a very long time, our lungs, it tends to collapse. So that thing to be prevented by the Pep device, or another name of this Pep device is Acapella device, which we can use in COVID-19 cases. Then we have inspiratory muscle training, where we are training the muscles in and around the chest to have a to increase the inspiratory capacity of the lung. Okay. Next is the oxygen therapy and nebulization, which is to increase the oxygen capacity of the body, or which usually decreases because of the lack of like inspiration or lack of breathing or breathlessness. Okay. So this thing to be revert with the help of oxygen therapy. So in adult patients with COVID-19 with severe respiratory distress, prone ventilation for 12 to 16 hours a day is recommended. So we recommend almost 12 to 16 hours of prone ventilation, which is given to very severe cases of COVID-19. Yeah, next slide, please. Yeah, I have given the picture of Pep device where the person is putting a pipe in the mouth, and like how this device looks like. And
Priyanshu, please zoom the photo. Priyanshu, please zoom the photo so that we can clearly see it.
Yes, it's very small. It came very small. Yeah, you can zoom it. And that is the active cycle of breathing technique I have given there. Yes. So this is the Pep device which we use. Okay. And the other picture is it is the active cycle of breathing technique, which only need to be done with the help of a therapist or a professional, where we are doing all the deep breathing. Then we are doing the half cuff, where we are mobilizing the secretions so that we can have a proper breathing cycle. Okay. Yes. To the next slide, please. So now the patient's treatment in ICU, I have given a overview of that. Now what we need to, as a physiotherapist, what we need to focus on, that is the deconditioning management. Deconditioning is, it's kind of like I'm on the bed, I'm in a ventilator, or I'm not having proper movement. So what happens? My body goes for deconditioning, which I need to revert back. That is called as deconditioning management. And next is treatment for post-ICU symptoms, or which is another word we call as rehabilitation phase. So I will go in detail about it later with a lot of pictures so that it will be easier for you to understand. And psychological support is somewhat, we are not psychologists, but definitely we have to have a role of psychological support for the patient during the treatment of COVID-19, because they are very much psychologically depressed, as they are away from the family, as they are away from the society. And this psychological support through exercises and even through a little bit of psychological counseling has to be given by a physiotherapist. Yes. Next slide. So how we will proceed? Okay. Yeah. Next. So managing breathlessness. So in these patients, when they come out of ICU, now they are in the semi-ICU or maybe in a ward. So we have to start with certain positions so that they don't feel the breathlessness now also. Because see, the whole lung, it goes through certain process. There is secretions, then we go for treatments, then the patient is under ventilator. So ultimately, all these things makes your lung weak. Okay. So once the person is outside the ventilator also, then also they may have a breathlessness in certain positions or certain point of time. So, so there are some positions that may reduce breathlessness, which the patient can try in day-to-day life. Okay. So people can also try the breathing techniques, which I will go in detail later also. So next slide, please. I have given certain positions of breathing. So here you can also zoom it a little bit. I have given certain positions for this. Yeah, the first position, see, this one will reduce the pressure on the lung. Then the next position is forward bend with the support of the table. Then we can also use the pillows there, okay, or a straight back. That will also help in reduce the breathlessness. Please go a little down. Yeah, I have given some other positions, like when they even go for later on, when they are more into the daily life routine, there also they can practice these positions if they feel breathless in certain point of their time. Yes. Next slide. Please reduce. Yeah. Okay. Now exercising after leaving the hospital. So now whatever exercise I'm going to tell, even a normal non-COVID patient also, non-COVID person also can do these exercises in home to make themselves fit, okay, during this pandemic or during this lockdown phase. So these exercises will help to improve the fitness, reduce breathlessness, increase muscle strength, improve balance and coordination, helps to recover deconditioning. So physical fitness will also improve thinking, reduce stress, and improve the mood, increase confidence, and improve energy. Yes, next slide. Yes, now I'll go to different set of exercises. So first one slide, what I have given here is the warm up. So before starting any exercise, maybe it's a COVID case or it's a non-COVID case. So here, warm up is something what we need to do at least 5 to 10 minutes before starting any exercises. So here I have given some of the exercises like neck tilts to either side or neck rotations. Then we can go for the hip rotations. Then for upper limb, we can go for simple upper limb movements, up, down, then sideways rotations. Please go down. No, not that. In that slide. Yes, warm up slide. Please go little up, up. Yes. Now here these all are for upper limb or the hand, and lower limb. Lower limb. There is one more. Yes, little down, please. Yes, for lower limb, we have stepping or marching in one point. Then we can little bit hop in one point, and we can also go for the forward, backward weight shifts. These all of the exercises will cause the warm up of the body. Okay. Yeah, next slide. Yes. Now, next is the balance exercises. So balance exercises are mostly for the patients who are coming out from a COVID era or COVID-19 phase. Okay, because they are more into the bed, they are weak, their muscles are not working properly. So in those cases, these balance exercises will help. And even geriatric cases, the old age people in home can also do these balance exercises to make their legs, to make their joints proper. So here I have included wide base of support standing. Meenakshi, it's coming something like start my video.
Yes, ma'am. I think now your internet connection is fine. So
should I click it?
No, do not start your video.
Okay.
This is going perfect. So later on we can start that.
Okay. Later, right? Okay. So now here, wide base of support standing. When we are standing with a wide base, both the legs apart. Okay. Then weight shifts on sideways. How we can shift our weight on sideways. That is one more balance exercise what we can give. Then single limb standing on one leg, walking on a straight line, and obstacle clearance. Now let us go to at least 2-3 exercises what I have given here as a picture. So let us go to the next slide, please. Yes, this I am given as the single limb standing. So here the person is single limb standing. Then the legs are, one leg is apart, one leg is back, and one leg is front. So these are the different movements we can do with the other leg. So these is the single limb balance with leg extensions and leg abduction. Okay, next slide. This is balance board exercise. Here is a board. There, I think all of you can see now. There is a board which called as the balance board exercise, which we use normally in a clinic. Even anyone can use it in their home also. So here, different balancing exercises, sideways, then front, back, then just horizontally, just keep standing on one position. We can do with this balance board exercise. With this balance board exercise, actually, so with this balance board exercise, we can go for different muscle strengthening. Okay. Just, yeah, muscle strengthening. So this will help a lot for the different cases. Yes, next. So this is walking on a straight line. You can just draw a line and you can tell the patient to walk on that so that they will have a proper balancing activity on that. Okay, this will help. This will help to balance the body. Next is the obstacle clearance. Yes, next slide. Obstacle clearance. This is something where we can put different obstacles on that straight line and we can tell the patient to cross that obstacle. This is a kind of a balance exercise which can be done in cases having a balance issue. Yes, next. So now we'll go to the breathing exercises. Okay, breathing exercises, which is very, very beneficial for a normal person and also to a person having a COVID-19 infection. So here in the breathing exercise, Yes, can you please zoom the picture? It is called as diaphragmatic breathing. Okay. So now I would like to first tell you what is diaphragm. Diaphragm, it is a dome-shaped muscle which is just below the your lungs. Okay, this is called as diaphragm. So when we are doing a diaphragmatic breathing, what we do is we take the air in through our nose and we try to push the belly out while we are inhaling. Okay, inhaling through the nose and try to push the belly out. Now, while you are exhaling, you try to just squeeze the belly in. That is called as diaphragmatic breathing. If anyone is having any issue in squeezing, then definitely you can put your hand over your belly and you can just push it inside while you are exhaling. So this exercise will help to strengthen the diaphragm muscle. Okay, is this clear? I hope this picture I have given, that's why, to show the movement of the belly. Yeah. Next is, next slide. Next is called as pursed lip breathing. Pursed lip breathing or fish lip breathing. This is done through the nose. We have to take the air in through the nose and we have to take the air out through our mouth. But while we are taking the air through our mouth, the mouth should have a very small opening. That is called as pursed lip breathing. So this pursed lip breathing will help your lung not to collapse and to have a positive pressure over your lungs. Okay. So breath in 2 counts, that is breathe in, and breath out with 4 counts, that is slow breath out. So that will help in managing the breathing of the patient. Yeah, next. So this picture is for the chest expansion techniques where we can expand our chest. Okay, as in most of us, we are sitting in the home and we are more into a certain posture, or we are working from home. So all these things will cause our torso or our trunk to go for a stooping posture. Okay, and the stoop posture will stop you from breathing normally, or to take the air in normally. So what we can do is we can go for your chest expansion. So these are some of the positions you can do for chest expansion technique, which will help your lungs to inflate more, okay, and to have more of the oxygen inside. This is another technique you can do in home. Yeah. Next slide. So after doing the breathing exercises, all of you can definitely practice in home. This is something I'm doing. I'm giving it for the general population also. So next is a strengthening exercise. Okay, what are the strengthening exercises we can continue in home? I have given very few. There are so many, but these are some of the strengthening exercises you can continue. Number 1 is biceps curls. Number 2 is wall push-ups. Biceps curls is something whenever I'm sitting in a chair, I'm just putting my hands out and I'm folding my elbow. That is called biceps curls. Okay, I can do it with weight on my hand. Otherwise, simply I can do. Next is wall push-ups. Next, arm raises to the sides. Gradually uses the dumbbells or weights will help increase the muscle power. Then sit to stand from a normal chair. I think this is something everyone can understand. Sit to stand from a normal chair. Gradually decrease the chair height. That will help you to strengthen your lower limbs. Okay. Then knee strengthening, wall squats, and heel raises. So can we go to the next slide where I have given some pictures so that it will be easier for you to understand. Yeah, this is a wall push-up. Okay, this will strengthen the upper hands. And this exercise again is very, very, you can say important to be done by the people who are having a stoop posture or forward bending posture, because we are continuously sitting in certain faulty postures and we can have a forward stoop. So this exercise will help to reduce that stoop. Also, it will help to expand your chest. Okay, this is called as wall push-ups. Next. Yeah, next is I have given only level 1. knee exercises. There are so many other levels also. So here I have, in one slide, I have given almost 7 exercises here. So all these exercises can be done to strengthen the knee. So here one point in between I have put as heel raises. So heel raises is also to be done in this way, holding some support. Okay. In the other picture, I have given a lady who is sitting on a chair and just straightening the limb. So that will also help to strengthen the knee. You can bind some weight near to your ankle, and that will help you to put more weight on your leg muscles, and it will cause a more of the knee strengthening. Yes. Next slide. Yes, this is called as wall squat. Okay, wall squat. So perfect wall sit is the first picture where the girl is sitting as if she's sitting in a chair, but she's actually pushing the wall along with her back. Okay, this is a very good strengthening exercises for lower limbs. Now in the next, left hand side next, where the girl is simply going for wall squat. And next to that, wall squat with lateral raise, where the girl is sitting. Along with that, she's putting the hands up. So this will indirectly causing strengthening of upper limb or the hands, along with strengthening of lower limbs or the legs. Okay, this is called as wall squat lateral raise. Yeah, next slide, please. So now is the fitness exercise. So fitness exercise, I think most of the people, they are now doing also in home. So this is something to be done by everyone. So under the fitness exercises, I have given only a few. Yeah, there are so many more, but definitely I cannot cover everything here. So marching on a spot, you simply stand in a spot and start marching. So you can increase the frequency of the march, which will help you as a fitness exercise. Then step up on a tool. So just take a small tool, step up and step down. Now gradually go for faster step up and faster step down. That can be done, which will help you to strengthen again your lower limbs. Then stair climbing, simple stair climbing. Do not use the elevators. Try to go for stair climbing, which will give you a good fitness exercise. Then walking, normal walking, definitely. Jogging and cycling and swimming. So these are some form of fitness exercises, which we can also call as an aerobic exercise training. Okay, these things should be done by everyone, COVID, non-COVID. Yeah, it is for everyone. Yes. Next slide, please. Now, after doing all these sort of exercises, you need to cool down yourself. So cooling down is somewhat similar to warming up. Okay, you need to reduce your pace. Walking at a slower pace or gently marching on a spot for approximately 2 minutes will help you to cool down. Repeat the warm-up exercises, that is stretching, all that, to move the joints, so that you can do it in sitting or standing. And muscle stretches, different muscle stretches can be done, which will help you to cool down the body. This phase, do not miss, because this is something your body is curling down now. Okay, next slide. I have given some pictures of cool down exercises also. Yes, these are some stretches which can be done to cool down the body. Okay, the lateral raises, the lateral stretch, then the leg up, then simply going down, or simply just stretching the lower limbs. All these things can be done. Yes. Okay. Next slide, please. Yeah. Almost 12 exercises. Yes. Now, key to healthy lifestyle in this pandemic. What are the things we can do to make ourselves fit? Okay, so that we can improve our immunity, so that we can be in a fitter state of life. So here, nutrition checklist for a healthy body. So you should have a proper nutritious intake, more of the protein intake. You can have multivitamins and other food supplements also to improve the immunity. Because see, if we have a good immunity, if you have a good physique, then we can fight coronavirus. Okay. Do any one physical activity daily for 30 minutes. Very important. Practice breathing exercises regularly. Then have plenty of water to hydrate the body. check on posture in day-to-day work to decrease the occurrence of mechanical pain. Because see, if I'm sitting in a bad position or I am continuing with a bad posture, then definitely I can have pain in numerous joints. So that causes us the mechanical pain. Okay. Now consult a professional for any difficulty. So if you have any such difficulty, you can consult a health professional for that. Yeah, next slide. Now, when to see a therapist by a general person in this pandemic? Okay, when you need to go to a therapist, because nowadays I feel more than having medicines, if you have your muscles to move, then you can have a better physics to maintain your body. Okay, I'm not saying about any condition or any disease. To make yourself fitter, you need to move more, and a physio can help you in that. Okay, so in ergonomical issues related to work from home, like we can have neck pain, low back pain, knee pain, tennis elbow or elbow pain, wrist pain, and due to excessive mouth use, we can have a wrist pain. Then postural abnormalities in kids and teenagers are nowadays seen due to more of mobile use during online classes. I am seeing the cases like that where the kids or the teenagers are coming with neck pain or the muscle stiffness. So this is occurring because of this online classes or continuously on a mobile or a tablet. Then joint pain and mobilization for old age people. Women health issues related to more of workload during lockdown. Okay, one thing here I want to add is, when we are psychologically frustrated or depressed, we tend to have more of the neck pain and the muscle pain near to neck. Okay, this is something we are seeing very commonly. So these are some of the conditions where you can reach to a therapist. I'm just putting few points. There are so many. You can come to us with any issues. I'm just putting some major issues which I'm seeing throughout this pandemic situation. Next slide. Then the geriatric conditions, the old age, what I have already told you, or consult a trained professional for any other conditions related to orthopedic, any injuries, any post-fracture cases, any ligament tear, you can come to us. Neurological conditions, for example, stroke, for example, Parkinson's, you can say multiple sclerosis, you can reach us for GBS. There are numerous conditions, okay, where we can help you out. Then geriatric or old age conditions, for example, osteoarthritis of knee or the back pain or osteoarthritis of hip or overall maintaining the health, definitely a physio can help. Then pediatric conditions, for example, cerebral palsy, autism, you can say Down syndrome, then delayed milestones, all these things can be treated by a physio again. Then cardiorespiratory physiotherapy, which is already I have discussed along with the COVID-19, and ergonomical or workstation related disorders. So here I would like to put a point from my side. I am actually I'm certified ergonomical advisor also, where I'm like modifying the workstation for the people so that they don't have any issues or any health issues related to their day-to-day work. Okay, so I'm advising for that also. Yes. Next slide. Now, after this, there is one more part which I would like to share with you all. That is the importance of digital health. Okay, digital health is something where now in this pandemic, it is not possible for everyone to reach to a physio or go to a clinic. So now this digital health, which is where you can reach to a physio or a professional through different apps or different digital ways where we can help you to maintain a good health. Okay. So now telephysiotherapy or digital health is simply means allowing healthcare professionals and caregivers to provide their services through telecommunication, which would require us to connect to the masses through any electronic device, because everyone is having a smartphone now and that is enough to reach to a physio anytime. And software without them to step out of their home. So telephysiotherapy helps people to consult a therapist in this time of pandemic where it's difficult to reach a therapist in clinic or hospital. Next slide. So here I would like to introduce you to one of my new venture, that is the Fast Cure Health. which is from the land of Assam, and we are trying to initiate a new era of digitalization. So Fast Cure Health is an initiative from the land of Assam where we are providing online physiotherapy consultation and home services also for the cases who needs urgent treatment in home. Okay, those patients who cannot reach us or even who cannot come to a clinic. So there we can send our therapist and they can treat them in the home. We do a complete assessment and prescribe treatment protocol, which is accurate and effective. Next slide. So we are just a click away, where in this Fast Cure Health, we are using different platforms as like Google Meet or Zoom, where you can definitely see us. We can have a video chat. I can assess it, assess the condition through the digital desk, and definitely we can have a proper treatment procedure, and we can also have a follow-up. Yes. Next. So home care is available with experienced physiotherapists through Fast Cure Health. Next. So we are giving assurance and assistance for different conditions which needs care and expertise treatment for a healthy living. So we are available for online booking only in fastcurehealth.com. And all of you kindly, I request to follow our Facebook page for regular health tips, because we are putting health tips and health talks in that. We are also available in Instagram. We are new now, but we are having a great vision so that we can give you a very good health forum in coming days. Next slide. Yes, so just get the best treatment from highly experienced physiotherapists through online consultation. Yeah, so just a talk from my side. Have a healthy life through a new vision in this new normal. So the prevention is not waiting for bad things to happen. It's preventing things from happening in the first place. So we always believe that prevention is always better than cure, and it actually is. Until and unless you prevent your conditions, you will have a very good way, a very long way with a good health. So we assure you to have a good health, and we also say all the best to everyone to have a good health in future. Yeah, next slide for any questions. Yeah, I'm open to questions now.
Okay. Thank you, Dr. Goswami. That was indeed a lot of, takeaways for us. And for people who have absolutely no idea about this whole field, it was a lot, of important information, actually. So my first question would be, at a time like this, particularly for physiotherapy as a discipline, I think a very important clientele for you guys is also people who are elderly and people, children. So at a time like this, because it's also very important to address concerns of safety. People are also apprehensive to immediately go and perhaps see a physiotherapist at this moment. So how do you really deal with something like that?
Yeah, see, as a physio, as we are working in a front line, we are we have to touch the patient. Okay, as a physio, we need to do that. So here, first thing is like all the measures we are taking, with all the temperatures checked, and we are having all the safety measures before going to a patient or before touching a patient. And even in so many clinic now, whatever clinic is opening now, what they are doing is they are only allowing patient and along with one attendant, and if possible with no attendant. So we are allowing like that so that we are having a proper safety measures. We can maintain a safety measure in our clinics. And if I'm going to treat a case, I need to use the gloves. So I need to put a mask or put a shield so that I can have a body contact with the patient with a proper safety. And also from both the sides, from patient and therapist both, we should have a proper temperature check and proper history taking before going to a patient. So we have to maintain this, because this era, this whole pandemic is actually causing a lot of issues now.
Right. So adding on to this, you mentioned something about digital health. So
Yes.
my question is like, of course, that would perhaps be the way out at a time like this, because we do not have any other alternative. So everything is anyways becoming digitalized. So, but as far as gaining people's confidence is concerned, because today somebody may not really have that necessary confidence to immediately seek for digital health or digital support. The amount of confidence that I would have perhaps by just visiting a clinic, whether that much of the same impact would I receive when I, seek some kind of a service. And also, this also adds on to another question which I have, because there is also this mushrooming of immediately, this digital health, or especially with a sector like health, we need to be really cautious about so many things. And at a time like this, every other day, we would see some new venture starting up, some new company coming up and providing services. So there are so many ethical questions also at the same time. So how, as a client, I would really ensure that through digital health or digital, physiotherapy, I would be getting the same quality of service which I would get when I go and visit a clinic.
Yes, see, now as for I would like to talk about first your health. Okay, so we are starting as a digital health, and why I have started this digital health forum, because throughout my whole you can say years of experience, I have seen that most of the people who can have one session or two sessions, they don't feel like coming for a clinic. Okay, sometimes they even go for a phone, like, please advise something for us here. So this is not possible for us on our side to say something on phone. So and in this time of pandemic, I have seen that people are having a kind of hesitation to come to a clinic, or to and to step in a clinic. So this is something actually causing, and some people, even I'm getting every day one or two calls from my old cases, like, our pain is increasing, what can help us, or I don't want to go to clinic because I have a fear, because everyone is getting now a fear of having this COVID. So although we are trying to ensure that, okay, we are maintaining all the safety measures, still people are having a hesitation. So how to reach, how to help people? So that's why we have started with this digital health. And I know every day I'm seeing new mushrooming of the digital health thing. For that, I think a proper degree, a proper experience of a person is needed. Along with that, a person who is reaching us, they should have a checklist for the definite you can say website also, where they can have a assurance that, okay, this person can make me better.
Assurance and the certification, because sometimes, when you try to do some good, or there's more problem than in addressing such issues, because there's more harm than actually good, because that also has happened in a discipline like psychology, where people without any certification just go and giving some kind of advice or service. So that is happening with every discipline. So it also raises a lot of important questions as far as ethics, certification, everything is concerned.
Exactly. I truly believe that. And one more thing I would like to say here is, through digitalization, when suppose we are going to see a patient, it is not only something that we will talk there, we will analyze the case. That is a part of an analyst. Okay, physiotherapy as an analyst. So I'm going to analyze. So here I would like to tell one thing to all the people who is watching me at this time, because see, in physiotherapy, it is not something that we are only showing the exercises. We have numerous assessment tools. Okay, we have numerous assessment charts, so through which we can assess the case. Even if I am going near to you, I have to use these assessment tools. So why not digitally? Okay, where we both are in a safe point, right? So I can use those assessment tools, I can analyze the case, we can have certain tests, and after that we can go for a proper exercise regime, and even I can go for a follow-up with the case, which will definitely have a better option in this time of pandemic, I think. Yes.
Okay, we had a similar question like this. So this is Chayanika asking, With the social distancing norm in this pandemic, how, as a physiotherapist, you are providing help to the patients with disabilities? Many patients are not being able to meet their physiotherapist, and as a result, their health is deteriorating. This results in both mental and physical breakdown. Can you give some advice?
Yes, yes. I know this is something happening now because most of the persons with disabilities or Divyangans, they cannot reach us, okay, especially in cases of children. And it is a lacking. It is something which is lacking now, where for what I'm really sorry. But I think this digital DEX will be a solution to a certain extent to those people because they cannot reach us. And uh, even for children, even the pediatric cases, we are also not going directly in contact with them. So definitely they are deteriorating. So what I want to advise for those patients, like have a contact with the therapist, either digitally or through phone, and go for a regular follow-up, maintain a diary, whatever exercises you are doing, try to write it down, go for your improvement list, whatever improvement you got, whatever problems you got, then again discuss it with your therapist. So this is the only way out now at this point. Or otherwise, whatever I told you is the safety measures, what we are maintaining, we can definitely reach to a patient with the safety measures for the home care. That can be done.
Okay. There's another question by Debargya Chakravarti. He says, how to treat the psychological fear and trauma that the COVID patient goes through while having the virus and even after recovery? How is COVID-19 risky for HTN patients? This is hypertension, I'm assuming.
Hypertension, yes.
Hypertension patients, yeah.
So hypertension cases are more prone for for having all the other severity of this COVID-19. So hypertension cases definitely see when a person is affected with COVID-19, we have to be more concentrated on the COVID-19 treatment. So along with that, definitely the hypertension part we have to treat with the medications, because at this point of time, medication is the only way out here, because we cannot, as a physio, I cannot reach to a very severe patient, or I cannot make him do any exercise at that point of time. So this is one thing. And psychological fear, that is something what we have to go for a little bit of psychological counseling while treating the case. And here one point I would like to say is continuous feedback to the patient, which can be in the form of biofeedback. We have certain different machines also which can give you a feedback of how your respiratory muscles or how your lung is getting better with the treatment. That can give a psychological assurance to the patient. Along with that, we can definitely go for a psychological counseling, which is also a part of our physiotherapy.
Right.
Okay. So
we have a question from Mr. Ravi Shankar. He asks, for preventive immunity building against COVID, what can be the ideal frequency of exercises per week for persons who normally do not have any habit of doing? So there is this whole question, like for me, as an individual, I also am not somebody who exercises a lot. But with this whole conversation around immunity building and, exercising becoming more important, so that I think that relates to his question as well. So what is the ideal frequency of exercises per week for somebody who has never exercised?
see, normally what I prefer is 30-minute exercise every day. But as like someone who is not an exercise person, so at least try to go for 3 days exercise a week. Okay. And the set of exercises, what I have told you, is not needed to do all the exercises in one day. Try to do, at least you can divide the exercise regime in, like one day I'm doing only my fitness exercise, one day I'm only doing my strengthening exercise, one day I'm doing only my breathing exercise. So like that you can divide.
Would this also be relevant for people who have certain comorbidities, like somebody who has diabetes or hypertension? Is it?
They can also continue. They also have to continue the exercises,
because generally with diabetic patients, they generally say that it's not really they don't suggest you to go for morning walks.
No, not
so
morning.
Certain preventive.
Yeah, they can continue the exercises in home. See, what I prefer is, now as we cannot go for morning walk, the spot march is one of the very good exercise program, or you can say it is a kind of it's an alternative to the walking. Spot marching can be done by any patient, which will give you similar kind of effect in the body. Okay, spot marching, and if anyone can do spot jogging. I'm not saying it for the elderly people, but normal people can go for spot marching and spot jogging, which gives you cardio improvement also.
Okay. So another question is, what could be the challenges or limitations that you are perhaps facing? This is a question from Mr. Suresh Susurya. So he asks, what are the challenges that you're having during video consultation? And I think he also has a question on payments, but maybe he can directly reach out to you later on for that.
Okay.
But what are the important challenges that you have been facing when you do video consultations? Because there is a complete shift in the approach when you go for video or digital, consultations.
Yes,
as compared to face to face. So what are the
Here,
challenges?
Here I would like to say that video consultations can be done for like most of the cases. For example, I can say 80% cases we can go for video consultations, but that 20% cases, it's difficult to treat in video consultation. For example, a person having a spastic stroke. Okay, I need to touch the patient. I need to do the exercising of that patient. I need to stretch the muscle which is going for tightness. This is one challenge definitely I have to overcome. Then next is some similar kind of some conditions where there is a neurological, mostly I can say neurological, severe neurological conditions where the patient is on the bed. For example, a spinal cord injury. In those cases, this video consultation will be a challenge. Okay. In those cases, definitely I have to go and reach the patient as a home care. Okay. So other 80% cases, definitely we can have a chat. We can have analysis of the patient. And because see, some of the time, definitely people may ask me that as I'm not touching the patient, how can I make out? So here the point comes of experience. I would like to say here the point comes of experience. I can, like my teacher taught me, like when I'm sitting in one point, a person is walking and coming to me, by seeing the walk only, my 50% diagnosis is over. Okay, this is something experience. So, so on my part, as a kind of 15 years of experience, I can say that I can definitely reach you for 80% of cases, but the 20% will be a challenge, which I have included here as a home care. People can reach me out for a home care. Yes.
So we can open the floor. If anybody has any question, you can directly unmute yourself and ask your question. I would request you to unmute yourself and ask your questions directly.
Yes, ma'am, I had a question for you. Like, have you ever, like, in mostly the Indian mindset, when if we don't get to see the doctor, we don't believe in them, right? There are many apps like Doc app and every, like upcoming new startups on in the medical line. So do you think the mindset will ever change? Like, have you ever felt
a positive approach for that? Yes, definitely. I think the mindset will be changed because it is a kind of new normal, and people are bound to change their mindset now. As even I'm changing my mindset. My mindset is like that because now also I'm having a fear to reach to a hospital. My daughter, I need to go for a vaccination from last few months. I'm just postponing because I have a fear. Okay. So I think this digitalization will help us to overcome so many things. And I know it is a very new thing. It's a new topic. It's a new field. So people will take time to accept it. But once they are seeing that this is something where we can get the feedback or where we can get the similar kind of exercises, so it will help. It will help them to overcome that thinking that yes, only going near to a therapist and seeing a therapist digitally can be similar. I think I have a positive mindset for that.
I think, yes, this is something which is happening across fields, because if I talk about education also, I mean, as Indians, we are still, still understanding this whole shift of approach to digital. Because
Exactly.
we even for us as people who are quite well acquainted with technology, we are still grappling with it. We are still trying to figure out new things and how do we really adjust our lives. Of course, it has its own challenges also.
Yes,
But like
yes,
you
yes.
just said, that I think, it is something that this will become the new way of life, and this will become the new way of dealing with things, if I'm
Yes,
not
yes,
wrong. So
yes.
we
We
will
have
have to,
to
yeah,
shift, and it will take time to accept. It will take
totally.
time to accept the new normal.
Yeah, and like for every sector, I mean, for everything, there are, flip sides to everything. So while there will be pros to a certain thing, there will also be the negative side of it, or, the side which where you really would need to look at it from a critical perspective. So I think this also applies to this
Yes,
particular
yes.
issue per se. We had a question, I think this was somewhat touched upon. This question is from Mr. Suresh Susurya. He asks, can assessment over a camera be as efficient as or by physical touch of the affected limb, etc.? I
Yeah,
think
see,
you had touched upon this.
some of the cases definitely we can have a challenge because, for example, to check the muscle power, maybe I will have a challenge in case of a neurologically affected patient. But most of the orthopedical cases or cardiorespiratory or geriatric, in these kind of cases, I think this will be a very good platform. Even in cases of CP, in cerebral palsy, in cases of children, it will be a little bit challenge for us. So then in that point, we are providing with the home care so that we can reach to our patients in home, and in those cases we can treat. Otherwise, because see, when we are going digitally, we have so many different tools. Okay, we have different analysis tools, and these analysis tools gives us an idea, and on that basis we are going to give the treatment to the patient.
Okay.
Okay. Nowadays technology has improved a lot. There are so many technological apps which has come up in physiotherapy also, through which
Hmm.
we can give that to the patient and they can do their exercises in home. Even they will get a feedback from those apps, and we can also get the scores from that. So these things are coming up. We are also new, so let us see. we will
Yeah.
uh, we will try to grab as much as possible, and we'll try to give you good health in the coming future.
Service, yeah, yeah. So my question is also about, I'm pretty sure that you must be talking about digital health in most of your talks or within your fraternity. So what, I mean, how have people responded to this whole idea of digital health? Because, like we just said, health is something that you always are always extra cautious, especially when it
Yeah.
comes to your children. Like you talked about your daughter, you have been extra cautious as far as her vaccination is concerned, or for somebody who's a pregnant lady. So how, what has been the response of people as far as digital health is concerned? How are they accepting or completely
See,
against this
yeah.
idea?
I think we have 4 months of like lockdown. So during
Yeah.
this 4 months or 5 months period, I have seen almost like 10, 15 cases. Okay, not more than that. I have seen 10, 15 cases. And out of
Mm.
this 15 cases, I think 12 cases has given me very good feedback. And within like few sessions, they could get good results. And other three cases, yes, there was a little bit challenge. And the improvement rate was not very high. So see, why I'm seeing like 15 cases now, as uh, it is a new platform. Okay, people are hesitant till now to reach us in this platform. So like few
Right.
people who had reached me, they were having that fear of coming to a clinic or coming in contact with physio also. So they preferred
Mhm.
this digital platform. So I got a good result till now in these 15 cases, and let's see in future. So hopefully it will be more beneficial in coming future.
Of course.
So
Yeah.
I think both of this platform will be there in this new normal, the digital and the clinic. So it's up to the people mindset, like how they want to reach to
Access
a
the service. Yeah.
yeah.
Okay. I think we have already overstepped on time. So is there anything, else that you would like to touch upon, or the floor is open for questions. If anybody has any more questions, we can take it up, or else we'll have to wrap the session with any closing remarks from you.
If no one has a question, I have one question.
Yeah, please go ahead.
Now we have seen like the physiotherapists and doctors talking about Parkinson, but no one talks about essential tremor.
Yeah,
And it's
kindly
been like
speak out.
neglected in India. Essential tremor. Essential
Essential
tremor.
tremor.
Essential tremor. Yes, ma'am.
Okay.
Essential tremor, yeah. It's been kind of neglected by the whole, not whole, like whoever I have approached to, I've never heard them talking about it, but they talk about Parkinson, but it's kind of neglected.
Yes.
And we have
Yes.
many foundations out there. Yeah, but why not in India?
Yeah. About the Parkinson, about the tremor part you are saying, right? I had just put my like earphone.
Yes,
it was not very clear.
Yeah.
Yeah. So here I would like to tell you one thing. That's what this platform is going to give you. I'm coming up with more and more talks in my Facebook page, because see, one thing I would like to tell is I am my whole research, one of my major part of my career was behind Parkinson's. Okay. I was associated with Parkinson Society throughout India, different Parkinson cases. So here, this tremor part, here the physical abnormality part, which a Parkinson case is getting, is not talked much in any of the neurologists I have never seen, if I'm right. So here in my field, in my digital health, I have a vision to have a proper support to certain this kind of cases, which is not talked much in the health field. For example, Parkinson. For example, Guillain-Barré syndrome. For example, you can say transverse myelitis. These are conditions where physiotherapy is the only way out. Okay, and these parts are not touched till now. So for me, I'm going to want to set an era of a new health talk, a new health vision, which will definitely will come up with different exercises, with different help to these kind of patients. So this is something, and I think there is a lacking in India. I don't know, like most of the neurologists, they don't prefer physiotherapy immediately. I have seen this more in Assam. So I want to request all the doctors, all the neurologists, especially neurologists, where physiotherapy is a must. Medicines cannot cure your muscle weakness. Medicines cannot do your movement. Medicines cannot make your balance proper. Physiotherapy is the only way out to keep your joints moving, to keep your muscles moving, to keep your brain having a feedback from your joints. It is the part of the physio. So I hope I will be able to talk more on this part. And this is a very good question what you have put today. Thank you so much.
Thank you, ma'am.
Yeah.
Anshu, I hope that answered your question.
Yeah.
So I think we've really had a enriching and insightful session this evening with a lot of new takeaways, new learnings, and in fact, your new initiative on digital health also looks really interesting. And I'm pretty sure that a lot of people will have more questions and will also reach out to you.
Yes. Please reach out. Please ask me questions. I'll try to help you my level best. Yes.
Yeah. So thank you, Dr. Goswami. It was really great
Thank you so much.
speaking to you. And we
Meenakshi,
hope to
there's a
stay in
question
touch.
from.
Yes.
Yeah, there's a
Yeah.
question.
Sorry?
Yeah, Milinda was asking a question.
Okay, Milin has a question. Yeah, Milin, please go ahead.
Sure. Thank you for your session. I wanted to know, first of all, it will be great to have your contact information and your Facebook details and your address if somebody wants to go. If you have already put it in the Piangshu, if it is in the PowerPoint, could you show that
I think she will share a flyer. She will share some of her details. We can share that on our page.
Yes, I will share definitely. Yes.
Okay.
You can reach me. Yes.
Okay.
Yes.
And I was also asking this for one of my cousin. he himself is a doctor and has problem with his knee, you know. And some people lose their muscle, I think, as they get older, and the leg become very thin, you know, and lose balance. They often, you know, lose balance. And again, male ego, whatever. I told him that, you know, I think you should see physiotherapy or something like that. I do not know what is it exactly called, muscle lose or whatever. Do you have anything to say about that? Yeah.
What is the age? What is the age?
62
what is his
plus.
age?
Around
62 plus. Okay.
Yeah.
Some see here, so many other points can come into play also. We have to see his bone density. We have to see his vitamin D level in the body, because sometimes if it is vitamin D deficiency, then body cannot take the calcium in the bone, and bone goes for depletion. Okay, along with the bone, your muscle also going for weakness. So definitely we can go for certain balancing exercises, even certain strengthening exercises to help his legs strengthen along with the knees. Okay, knee need to be strengthened, because knee extension, what we call, is very important while we are standing. So this will help him to regain his muscle strength, and it will also help him to have a better walk. Okay, so you can definitely, you can take my number, you can have a call for this personal session for the patient, and I can help you out. Okay, there are so many different protocols what we need to follow, but I need to first see him. I need to see his history part. So and I can definitely help you out.
Oh, all right. Thank you
Yes,
so much.
yes, thank you, thank you, thank you. Yeah.
Okay, so we'll call it a day. Thank you so much once again,
Thank
participants
you,
as well
thank
as
you.
Dr. Goswami. Thank you.
Yeah, okay,
Well,
bye
stay safe.
bye
Yeah,
everyone.
bye.
Please reach me, please reach our Facebook page, please like it for
Yeah,
the
we will
health tips
definitely
and the
share
health
all the
talks.
information.
Yeah,
we will share.
yeah.
Thank you.
Okay, bye
Bye.
bye, good
Thank you.
night. Good night. Yeah.